Today we're going to go through a simple core strengthening and stretching routine for low back pain. So this is really a great program for anyone that has mechanical low back pain or low back pain history. Always consult your doctor before practicing, but this is a nice little routine that I actually perform quite often. I have a lot of low back pain, so come along with me. We're going to start with pelvic tilts. So all that means is we're going to flatten the low back down into the floor. So you can kind of see my hips are rocking up just a little bit to flatten my back, and I'm engaging my core. So I'm going to move my arms just so you can see it's a flattening down. We're not arching our back up. So we're trying to close that space from the back to the floor. We're going to do 15 more of these at your own pace, thinking about getting the hips starting to move. And this is going to be a foundational position for a lot of the postures that we find ourselves in today. So just taking a moment, the first couple may feel a little bit stiff and tight, but as we go along, the low back paraspinals, the muscles that go down either side of our spine, are going to loosen up and our core is going to start to activate. So starting to feel the abdominals engaging, you may think about kind of squeezing in and engaging those muscles. And we really want to avoid pain with any posture. I'm okay with a good discomfort and a muscle working, but anything that's red flag pain that tells you this doesn't really feel good or is making you hold your breath, it might be a little bit too intense. So meet yourself where you're at today. There's no rush to go any further than feels appropriate. And you can always come back to this practice and just kind of see how much your strength has improved. So we'll go ahead and still the back. We're going to bring just your right knee into your chest. And you can hold the knee, you can hold the back of the leg. You can use even a hand towel to place behind the leg and use that to hold on to. Whatever feels good to you, and you can back off, avoiding any pinching sensations in the front of the hip. And again, the first one doesn't have to be the best one. I tell this to my patients and clients all the time. The first one is just to kind of explore and see where you're at. So we'll begin to switch legs whenever you're ready. So if where my leg feels a little bit too intense, just back off. Eyes can be open or closed. Go ahead and switch legs back to the right. And then switch back to the left. So with these stretches, I want you to be able to freely breathe. We're holding roughly 10 seconds or 3 to 5 breaths. And then we'll come back to the right one more time. And then back to the left one more time. And then from here, we're going to place the left foot and the right foot down. You may want to grab your Pilates ring or even a pillow you can fold in half. You don't have to have a Pilates ring. A pillow or a ball or a yoga block works really well here. So we'll place whatever you have between the knees, arms by your side. We're going to engage the core like we started out with, and then squeeze your knees together until you feel your inner thighs engage. And then relax. You can relax your back. And then pelvic tilt and squeeze the object between the knees. And relax. So we're squeezing and engaging for about 5 seconds. And this can be a sub-max effort squeeze. So we're not trying to bust the pillow or break the Pilates ring. We're just feeling the muscles engage. I'm actually quite weak in this area, so I shake a little bit on these. This one's great if you have a history of like SI joint pain. We don't really engage these inner thigh muscles often just on their own, so it's always nice to kind of work these. We are doing 20 of these in total at your own pace. Again, engage the core, squeeze the knees, 5-second hold, and then relax. Take a few more moments just to finish out your set of 20. And low back pain is actually quite common. It's probably one of the most diagnosed pathologies, especially in PT, that we see. There's lots of different types of low back pain, so again, making sure that you are speaking with professionals before you engage in exercise, but this is a great routine, like I said, for just general mechanical low back pain and neutral spine strengthening. So the idea is that everything else moves around the spine is staying nice and still. And when you finish your set of 20, we'll go ahead and remove the object that you have between your knees. And we're just going to bring the right knee and then the left knee into the chest for a double knee to chest stretch. So almost kind of like a happy baby, just a little bit easier. We're just gonna hold the knees or the backs of the legs. You can stay still or rock side to side. And then we'll lower the feet back down. We're gonna do 2 more of these. So hugging knees back up, you can hug one knee in at a time if it's pretty aggressive on the back. If rocking side to side feels good, go for it. And then we'll lower the feet back down. And then 1 more, knees to chest, avoiding a pinch in the front of the hip. It's a nice, easy low back stretch. And then we'll place both feet back on the mat. And if you have a resistance band, you can take it above the knees now, or you can even use your Pilates ring on either side of the knees, just slipping both feet inside the ring and pushing out on the ring now. If you don't have a band, don't worry about it, don't stress about it. No band is fine too. But if we have the band, we're going to keep the knees pushed out against it and try to keep your knees in line with your hip bones, your heels in line with your hips as well. Hands by your side, rock up onto the shoulders. And then we're going to press strong into our feet and drive our hips up and engage the hamstrings and the glutes and avoiding low back pain. And then just keeping the back nice and straight, come back down. Driving straight up and then coming back down. So the basis for like a hip hinge pattern, or if you've seen a deadlift pattern before, this is a hip hinge. Very functional movement. We are taking 20 bridges. For some people, this is going to be a little bit more challenging, so you can do sets of 10 or just 1 set of 10 if you want, resting as you need to. If this is really, really easy and you don't really feel much with this one, you could do single leg bridges, 10 on each leg instead of a double leg bridge. But again, avoiding pain in the low back, just engaging the muscles of the legs and the core. Avoid letting those knees cave in. Keep the knees pushed out against that band until you hit your set of 20. Good. And just little baby rocks of the knees side to side if that feels good to you. And when I say baby, I mean really, really small. We still have that band on, so we're just kind of letting the hips relax for a second. So we just engaged the back of the hip, the gluteus maximus, which we kind of all know. But we're going to work on your gluteus medius now. So we're going to roll to your side. Let's roll to the right side. And almost like you're laying in bed, that left arm is around. And we're going to start to engage the abdominals. So feet stay together. Knees are stacked on top of each other. If we have the band on, it's above the knees. That left hand is down on the floor, not resting on the thigh. And we're going to begin to lift the left knee up until we feel like we're going to roll back. So I don't want you to roll the chest open. We're staying really, really still in the back and just letting the leg and the glute do the work. We're going to take 20 per side if you can, but always feel free to do 10 or 15 reps if you need to, or just sets of 5. Again, meet yourself where you're at, and you can always come back to this practice and see your improvement. So keeping the core engaged, Keeping the back straight, you're going to start to feel it through maybe the glute and even the side of the leg. And these muscles keep our hips level when we walk. It's a hip stabilizer and even a knee stabilizer. And we kind of consider the hip the keystone of the body, so all movements really are stabilized through the hips and the core. And this is a great and challenging exercise that pretty much all of us could benefit from. And if you find the band is way too difficult, just do this one without the band and start using a band whenever you feel ready. And once you get to your set of 20, we're going to switch sides. So now rolling onto the left side, you can kind of see a little bit better. We're not arching the back, we're tucking that tailbone, that same position we started in, and our feet stay together. That right hand is down on the floor. Engage the core and then lift the right knee up. And only going as high as you feel like you can control without having to roll open. We're taking anywhere from 5 to 20 on this side at your own pace. You can see a little bit better here, the heels, the feet staying together, and just getting a little external rotation of the hips. And this exercise is great because not only are we working the top leg, but we're also working the bottom leg. It's our stabilizer leg. So you may still feel that left hip from the first round of these on the other side. I also like this movement because it's what we consider a unilateral movement, so one side versus the other, not both legs moving at the same time. And you start to see where your imbalances are. So I'm a little bit weaker on my right side. I have a long history with my right hip, knee, and low back, so it's a little humbling. But we'll come back onto the back, pull the knees to the chest, and then we're going to take the band off if you have it on. You just place that to the side, and we're going to just rock the knees in the chest, maybe rock side to side. And then lower the left foot down, but keep holding on to the right. And we're going to grab the back of the right leg or use that hand towel if you need it. So gently begin to lift your right heel up, but then bring it right back down. So just kind of tapping the edge of a stretch and then bringing it right back down. So moving very fluidly. We're going to do 10 of these at your own pace for a dynamic hamstring stretch. So I have a lot of radicular pain going down my right leg, and I find that this is a little less aggressive on that nerve, just kind of gliding and flossing the muscle instead of a long, aggressive stretch. And then we'll place the right foot down and bring the left knee into your chest. And then again, gently kicking the left heel up and then bringing it back down. So I have my left heel flex that's just mostly out of habit, but if that's a little too aggressive, you can relax your left ankle and just let that stretch be a little bit more passive. But taking 10 of these at your own pace on the left side. And then we'll place the left foot back onto the floor. And then hands by your sides, again, just swinging the knees like a swing, just back and forth, nice and easy. It doesn't have to be really big. Just something that feels like a massage and something nice on the low back for a little rotation. And then we'll begin to still the knees. Let's bring the right knee into the chest and then cross your right ankle over your left thigh. So option to kind of hold and brace the knee and the ankle with your right and left hand, or just rest the right heel on the left thigh. You could even push your right hand into that knee and kind of get a little hip opener there. If that doesn't feel good, you can grab the knee and the shin and pull that towards you. So just different options here for the same kind of stretch. And if that doesn't feel good, you could even just rest the heel and pull the right knee towards the opposite shoulder. or go for a full figure 4 stretch, grabbing the back of the left leg or the front of the left shin. So again, meet yourself where you're at. If this stretch is way too aggressive on your right hip, just find one of those options that I just mentioned that feels good to you. We'll hold this for about 10 seconds. And then we'll place the left foot on the floor, and then stretch your right leg out, and then just relax your right leg and just kind of oscillate it, just shaking it. Let that hip relax. And then rebend the right knee, pull your left knee to chest, cross the left ankle over right thigh. Option to brace and hold the leg to control the stretch a little bit more, or push the left knee away from you if that stretch feels good. You could pull the shin closer to your chest, or just let that right knee come up and grab a hold for a figure 4 stretch. So maybe feeling this in the back of the left hip, maybe in the left hamstrings, the back of the left leg. But something that you can breathe through for 10 seconds. And then we'll place the right foot down, left foot down. Left foot stretches out, relax, shake the leg out. And then we'll begin to rebend the left knee. We're going to do that again on the right side. So crossing ankle over, going right for the stretch that feels good to you, holding 10 seconds. And then place left foot on the floor, stretch your right leg out for just a moment. And then rebend the right knee. We'll do the same thing on the left side. So crossing left ankle over right thigh and find the stretch that feels good to you. A piriformis stretch, external rotation stretch. And then we'll place both feet back on the floor. Stretch that left leg out for just a moment. And then rebend the left knee. And then we're going to begin to work into a more dynamic core strengthening exercise. So we'll place the hands straight up in the air, almost like you're grabbing an imaginary beach ball. Or if you have a Pilates ring, you could do a little squeeze there. And we want to engage the core. So find that pelvic tilt that we started out with and attempt to hold that posture here. So not letting the low back come off the ground. We're going to stretch the right leg straight out and keeping that low back flattened to the mat, begin to bring the right foot in. And then stretch the left leg straight out, keeping your low back pressed to the mat, and then bring it back in. So back on the right, we don't want that back to arch up. We want to keep it flat, and then over onto the left side, and then bring that leg back in. So if we need to stretch the right leg up a little bit higher and then the left leg up a little bit higher, that's okay. As you get stronger, that leg will be able to lower with more control. Good. And we'll do one more on each side. So right leg straight out and bring it back in, and then left leg straight out and then bring it back in. So if you have the Pilates ring, go ahead and set it to the side and let the arms just relax down. So if you have a lot of shoulder issues, we're going to keep those arms just straight like they were. But if you feel pretty good in the shoulders, we're going to stretch the right leg out, flatten the back, and then reach the left arm straight back overhead. Not arching up, but keeping the back flat. Then bring left hand and right knee back in. Then begin to stretch the left leg straight out and the right arm straight back overhead. Keep the back flat to the mat. Bring arm and leg back to center. Right leg and left arm extend and then come back in. And then left leg and right arm extend. So opposite arm and opposite leg, and then come back in. Again, right leg, left arm extend and back in. Left leg and right arm extend and back in. One more time on each side. Right leg, left arm extend, and come back into center. Left leg and right arm extend, and come back to center. Let the elbows rest by your sides. Let your feet relax and just gently rock your knees from side to side. And then when you're ready, go ahead and still the knees. We're going to heel toe the feet to touch. Let the knees open out and let your arms just relax into a reclined butterfly pose. So if you have wrist, shoulder, knee issues and being in weight-bearing positions is difficult for you, go ahead and end your practice here. This is a great place to stop the video. But if you feel pretty good in a quadruped position, so putting weight through the knees and the wrists, we're going to come on to our right side and then press up and come into hands and knees when you're ready. So spread your fingers wide to support your weights of your body on your wrists. Let your knees come directly underneath your hips. So elbows are straight here as we begin to lower the belly a little bit or a lot. And if it hurts to go down a lot, just kind of monitor yourself and raise up if you need to. And then we're going to round the back, the upper back, the lower back towards the sky, maybe even move chin to chest. Let your belly sink back towards the floor and maybe take your gaze in front of you. And then roll your spine up towards the sky as you move your chin to your chest. Let the belly drop down, open up the back, and then round the spine up and extend through the back of the neck. And then we'll come into a neutral spine. So again, knees are just directly underneath our hips and our wrists are directly underneath our shoulders. Our elbows are not bending. We're going to straighten your right leg straight back. So don't let your belly hang down. We want to think about if your spine was fused, it could not bend. And we don't want that right hip to roll up. It's a little bit easier to go there. Roll your hips down, engage that core, keep your back knee straight, and feel your right glutes engage. Bring your right knee back down and then stretch the left leg straight back, keeping your back nice and long. So we're not rolling open, we're not dropping down. We're staying very engaged in the back and the core. And that knee, that left knee, is not bent, it is kicked back. So think about kicking the wall straight behind you. Your gaze stays between your hands. Don't let the elbows bend, keep your shoulders strong. Left knee back to the mat. Good. And if you find that the elbows are bending, just think about wrapping them towards each other. Right heel kick straight back. If it's available, reach your left arm straight forward, almost like what we just did on our back. That arm can be low or it can be high, but not so high that we're losing it in the back. Think about prioritizing your spine above everything else. Come back to center and then kick your left heel straight back and your right arm straight out. Engage your core, square your hips. Good. Come back to center, stretch your right leg back and your left arm forward. Let's hold it for 5, 4, 3, 2, 1, and then come back to center. And then left leg back, right arm forward, hold 5, 4, 3, 2, 1, and then come back down. Again, switching, right leg straight back, left arm straight forward, hold 5, 4, 3, 2, 1, and switch, hold 5, 4, 3, 2, 1, and switch, hold 5, 4, 3, 2, 1, and switch, hold 5, 4, 3, 2, 1, and then come back to center. Switch, hold 5, 4, 3, 2, 1, back to center, and switch, hold 5, 4, 3, 2, 1, and then come back to center. Good. Begin to let the belly sink down, open up into that cow pose, and then exhale, round up into cat pose, and then just sit your hips back towards your heels. Find a child's pose. Hold here for just a moment and then come back up into hands and knees. Drop belly down, look forward, round the back up, chin to chest, and then sit back into a child's pose for just a moment. Come back up into hands and knees. Again, we're going to go through that cat-cow sequence. So dropping belly down, open up the chest, round the back up, opening through the back body, and then sit back into a child's pose. Take a moment of rest here, and then come back into hands and knees when you're ready. And we're going to move through one of my favorite exercises for the core. We're going to come down onto your belly and then prop up onto your elbows. So you can be shallow here or you can prop up, but I don't want those elbows to move in front of the shoulders. Those elbows stay stacked right underneath the shoulders. Hands can be together or apart. And we're going to stay on our knees and come into a modified plank position. So you can see how flat my back is. I'm not pushing my butt back or walking my elbows back. If I come from a lying down position, a prone position, I'm going straight up into this plank. Tuck your tailbone, squeeze your glutes. Don't let your tailbone flare back. Just tuck it underneath you and feel your abs engage. We're going to hold here from anywhere from 5 to 20 seconds and then lower back down onto the belly. We're going to take 2 more of those, and I'll give you options to make this a little bit harder. So again, coming back onto knees, tuck that tailbone underneath you. Keep those shoulders right on top of the elbows, and the weight is just nice and distributed throughout the whole body. Toes can be untucked or tucked, it does not matter. Again, holding anywhere from 5 to 20 to 30 seconds. If you need to come out of this before I do, that is totally fine. Just find that rest position. And then we're going to take one more, maybe staying on knees to start. And if that felt pretty easy, we can tuck the toes and extend the back. But again, we don't want to lose that engagement of the core. So keep that tailbone tucked, keep your back nice and flat. Shoulders are rounded up to the sky. So think about pushing the earth away from you with your elbows. We're going to hold anywhere from 5 to 20 to 30 seconds. Breathe through it. If you feel pain, come out of it. If you feel discomfort, breathe through it. When you are ready, drop to your knees and then lower all the way down to the belly when you're ready. Take a moment just to traction your elbows back, pull your heart through and forward if this feels good on the low back, just for a little lumbar extension, and stretch out the front body, the core. When you're ready, we're going to just maybe place the hands on the floor and just push back into a child's pose. Hips can stay lifted here if this posture is not very relaxing. And then we're going to come back into quadruped and begin to take your right foot in front of you for a lunge position. So if you need a chair or something to hold on to for balance, that's okay. You can bring that beside you. Otherwise, both hands are on our right thigh. And let's think about stretching the front of the left hip. So we want to push our hands up so that our upper chest is now running perpendicular to the floor. And we don't want to extend into the low back. So think about tucking your tailbone. Don't dump into that low back. Squeeze your glutes and then maybe drive your right knee forward a little bit. If it's available, reach your left arm straight up into the sky and then lean over to the right. And you'll feel your psoas begin to stretch to the hip flexor muscles on our left side. And then return back to center. We're going to just back off of that knee a little bit, so lean back on the left knee for just a moment. And then again, we're going to drive our weight forward, tuck your tailbone, squeeze through your glutes. Maybe play around with opening that left foot towards the right edge of your mat and feel a little bit more of an inner thigh stretch on the left leg. We're going to reach the left arm up and then lean over to the right again. And just see if that pose feels good to you. If it does not, just keep your back leg straight and your hips squared. Good, and then return back to center. This time we'll take the left foot straight back again. Just back off the stretch for a moment. And one more time on this side. Again, maybe going a little bit deeper on this last one, reaching the left arm up if you like, and leaning to the right, holding about 10 seconds. And then we'll come back to center. So bringing the hands down to the earth, take your right knee to meet your left, and then we're going to take 3 cat-cows, dropping the belly down, look forward, and then round the back up. Maybe take a breath in as you drop belly down, look forward, and a breath out as you round the back up. And then one more time, drop belly down, and then round the back up. So this time we're going to step our left foot forward, place our hands on our left knee or a chair or the couch, whatever you need. But we're going to begin to tuck our tailbone underneath us to protect the small of our back, and we're going to lean forward as much as we can without losing that control. And reach the right arm up to the sky and softly lean over to the left if that's available in that right shoulder. If not, just stay where you are. Nice long hold. And then we'll come back to center. So again, playing around with spinning your right foot towards the left edge of your mat and opening the hip a little bit more, reach your right arm up, and then leaning over to the side. So kind of getting a side waist, inner thigh stretch if that feels good to you. And then we'll come back to center, stretch your right foot straight back, and going into the fullest expression of this stretch, driving that left knee forward, keep your tailbone tucked, squeeze your glutes, right arm rises to the sky and lean to the left. And the cats are going a little crazy. Sushi cat, if you've done any of my classes in the past, is on the other side of that door, and Jolene is not loving it, so sorry about that. When you're ready, return to center. Bring your hands back to the mat. We're going to do 3 more cat-cows. Inhale, drop belly down. Exhale, round the back up. And this is just a really great way to mobilize your facet joints in your spine. They allow us these different movements of our back and can get really stiff over time. We'll come back to center and then gently come into easy seat. And we'll all find our way onto our back. Maybe grab the backs of your legs, assist yourself rolling one vertebra at a time, or you can just lie on your side and roll back onto your back if that's more comfortable. Begin to stretch your right leg straight out and bring your left knee into your chest. And then open your left arm, keep holding that left knee with your right hand, and then twist that knee across your body a little bit or a lot. Maybe even look to your left hand and just find a really passive spinal twist. And then we'll come back onto your back. Place your left foot down, bend your right knee back up. Right knee into your chest as your left leg stretches out. Open your right arm to a half T and look to your palm as you twist that right knee across your body. So if what I'm doing feels just insane and way too deep, you just stop where it feels good to you. And then we'll come back onto the back. Place your right foot down and bring your left knee up. Place the bottoms of the feet to touch, again for reclined butterfly. Take a moment here just to relax the upper back, the lower back, the legs. Feel the inner thigh stretch. And then we'll begin to close the knees, roll to the right side of your body. Opportunity for a moment of gratitude here. And then we'll gently come up to a seated position when you're ready. Thanks so much for practicing with me today.